living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
If you are one of the 54 million Americans who has arthritis, I don't have to tell you it's pretty common. But for most people, there are a lot of unknowns when it comes to arthritis. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Today we're going to talk about what you didn't know about arthritis. Stay with us, we'll be right back after this. Welcome back to Healthy Living for Life. Last week we talked about bone health, and this week we're continuing that conversation, focusing on the joints and arthritis. Joining us again is Dr. Doug Kunzweiler, and thanks so much for being here again with us.
Good to be here.
So let's start out with the basics and just define what is arthritis.
So arthritis is a condition where you have inflammation, which you can think of as irritation of one or more joints in the body. So a joint that's painful or swollen or giving you trouble.
And how many types of arthritis are there?
A lot. I've read that there are over 100 different types of arthritis, but the main ones are osteoarthritis, rheumatoid arthritis, gout, and psoriatic arthritis. Those are probably the most common, and then there's a whole raft of other less frequent types.
Okay. And we're going to talk about a couple of those here in just a few minutes, but what do all of those conditions have in common? What are there common symptoms? How do you know it's categorized as arthritis?
Yeah, they all cause pain in a joint, and that's usually accompanied by swelling. It's always accompanied by stiffness, sometimes grinding or cracking or kind of a noisy sensation in the joint. And sometimes there's even some redness or warmth in the skin over the joint.
Okay, so let's talk about some of the common ones you mentioned. We'll start with rheumatoid arthritis. So what specifically makes a type of arthritis rheumatoid? What does that mean?
Rheumatoid is one of the autoimmune diseases, and that is when the body's immune system, which is supposed to defend us from outside things that want to hurt us like viruses and bacteria, it's when our immune system attacks our own tissues. And what happens in rheumatoid arthritis is our immune system forms antibodies to the lining of our joints, and that causes inflammation and actually deterioration of the joint itself.
So can you talk about how rheumatoid arthritis progresses?
Well, it generally starts at a somewhat younger age, 30s or 40s, and it varies in its course. It tends to be kind of a gradual onset that takes place over months to years, although sometimes it can progress more rapidly. And it can also, in some people, have periods of remission where the disease seems to quiet down, and then it may come back at a later date.
So about 40% of people who have rheumatoid arthritis actually experience symptoms that don't involve the joints. Can you speak to that a little bit?
Yeah, in addition to attacking the lining of the joints, sometimes in rheumatoid it will attack other tissues. It can attack the blood vessels in the heart and can even lead to heart attacks. It can attack some of the valves in our heart and lead to troubles there. Sometimes it involves the lung. It attacks the lining of the lung, and that can lead to stiffness and scarring of the lungs to make it hard to breathe. It can attack the bone marrow and lead to a form of anemia or low red blood cell count. So it can at times attack a lot of different tissues in the body.
Okay. Well, let's switch and talk about another common type of arthritis, which is osteoarthritis, which I understand is actually more common than rheumatoid arthritis. So how are those two different?
Well, the rheumatoid arthritis, as we talked about, is a systemic disease, really. That doesn't mean there's something going on in the body's basic systems that causes that. Osteoarthritis you can think of as a wear and tear sort of arthritis. It's confined only to the joints. And it is a sort of a gradual wearing down of the cartilage that protects the joint until you have bone rubbing on bone, and that's what causes the pain and the swelling and the stiffness.
Are those the main symptoms, or are there other signs and symptoms people would be able to flag that it could be osteoarthritis?
The main thing is pain, and then stiffness, and a loss of your normal range of motion of the joint, and then possibly some swelling. You might see some redness in the skin, and sometimes you'll also notice that the joint itself kind of gets little bony bumps around it, especially in your fingers and your hands. You can notice that.
And so, like rheumatoid arthritis, osteoarthritis can also progress and worsen over time. Once that damage, that wear and tear that you're talking about has been done, can it be reversed?
You know, there are things we can do that can improve the discomfort. There are things we can do that can improve the range of motion, but we really can't reverse the damage when it happens. However, there is joint replacement if things get bad enough, and almost every joint in the body now can be replaced if it warrants that.
If a person is experiencing pain in his or her joints, at what point is it time to see a doctor?
Well, a general rule of thumb is if it lasts more than a week, then you probably ought to think about seeing your care provider. If it is interfering with your normal function, if it's keeping you awake, if it's interfering with your enjoyment of life, though, then it's definitely time to see your provider.
Okay, great. It's time to take a break, so we'll need to pause here. But coming up next, we're going to talk about the causes and some of the risk factors when it comes to arthritis, one of which has to do with gender. We'll talk about that when we come back after these messages. Stay with us. Welcome back to Healthy Living for Life. This morning we're talking with Dr. Doug Kunzweiler about joint health and arthritis. And so in general, Dr. Kunzweiler, do we know what causes arthritis?
Well, we have a pretty good understanding of what goes on, but for instance, in rheumatoid, we don't really know why the body turns on itself in these autoimmune diseases. There are lots of theories, but nobody's really sure why that happens. In osteoarthritis, it's a wear and tear, aging of the joint, and gradually wearing it down seems to be the cause.
Are there risk factors that can make people more susceptible to getting arthritis?
Certainly. Some of it is genetic, especially with the rheumatoid diseases. They can tend to run in families. But even osteoarthritis, there are some families that seem to be more prone. Your occupation can be a factor. If you're in a job that puts a lot of stress on your joints, there's a chance that you're going to develop osteoarthritis later in life. We know that having a prior injury to a joint, fracture or something like that, years later, that joint is going to be more susceptible to osteoarthritis. If you are obese, that puts more stress on your joints and you're likely to have more. With rheumatoid, we also know that women are about 4 times more likely to have rheumatoid arthritis than men. So there are some definite factors.
And that was actually going to be my next question, that we do know women and men can be different, and arthritis falls into that category. So why are women more susceptible to developing arthritis than men?
Well, with rheumatoid, we don't really know. That's where the difference is the most striking. We think probably there's some sort of hormonal influence there, but that really hasn't been worked out yet. Osteoarthritis, both men and women are prone to osteoarthritis in about the same proportion.
Okay. Are there joints that might impact women more than men when it comes to developing that wear and tear and leading to arthritis?
Yeah, the osteoarthritis likes the hands and the wrists. And so if you have an occupation, especially that puts a lot of stress on your hands, you're likely to have trouble there. And then after that, it's major weight-bearing areas, such as the lower spine the hips, the knees, sometimes the feet and the ankles, but any place that gets high stress.
And that's the same for men and women?
It's pretty much the same there for men and women, yes.
Okay. Can you talk about any connection between breastfeeding and rheumatoid arthritis?
Yeah, that's an interesting area. It turns out that if you breastfeed, your chances of developing rheumatoid are cut in half compared to a woman who doesn't breastfeed. And again, we don't really understand why that is. There appears to be some sort of hormonal influence, but hasn't really been worked out yet, but it's definitely there.
Okay. Last week we talked about bone health and we focused on osteoporosis. Are osteoporosis and arthritis related, connected? Is there any commonality there?
They're not related in terms of cause, but if you think about it, if you have arthritis, you have stiff, painful joints, there's a likelihood that you're going to be less physically active, and that lack of activity can lead to osteoporosis. So that's where the link is, but in terms of cause, they're not really linked that way.
Okay. Let's talk about some of the complications that can develop because of arthritis. Can you speak to those? I'm sure there are some with the wear and tear, but what about having the inflammation in your body?
Yeah, any of the autoimmune diseases can cause a lot of chronic inflammation, and that inflammation alone has negative effects on our body. It can interfere with sleep. Some people talk about brain fog, where it seems like people just cognitively aren't as sharp as they were before the inflammatory processes started. It can lead to weakness, loss of bone, a whole variety of things that come with the chronic inflammation.
We have talked about age being a factor when it comes to arthritis. A lot of folks might not know that children can actually get arthritis. Can you talk about that and how that might be different in children versus adults?
Well, the juvenile rheumatoid arthritis is exactly the same process that goes on in adults, but it can start in children quite young. 3 years old, 4 years old is not uncommon. And again, it is their autoimmune system that turns on their own tissue and causes this inflammation in their joints. One thing that is a little bit different is that it also seems to have a predilection for the sclera, the white part of the eye in children. And that can lead to things like glaucoma and even blindness. We see that more commonly in children with the juvenile rheumatoid than we do in adults.
Another one that people might not have realized is that gout is a type of arthritis. What is gout and what causes it?
Yeah, so gout is tiny, tiny crystals of uric acid. Uric acid is one of our byproducts of our body making proteins. Tiny, tiny crystals of uric acid settle out in the fluid in the joints. And then it's sort of like having sand in a joint. It leads to extreme pain, and it can even cause deformity of the joint.
And unlike other types of arthritis, men are actually more susceptible to gout than women. Can you talk to that? Why is that?
It's true, but we don't really know why.
Oh,
like
really?
A lot of things. Yeah. No, again, there's probably some hormonal influence. Maybe it's a genetic component. It's not really well understood. But yeah, it is more common in men than women.
Okay. All right, great. Well, it's actually time for another break, so we are going to pause here. But coming back, we'll talk about diagnosis, treatment, and ways you can manage arthritis at home. Stay with us. We'll be right back after these messages. Welcome back to Healthy Living for Life. We're still talking with Dr. Doug Poonsweiler about bone and joint health and specifically arthritis. So thanks for staying with us, Dr. K. Let's talk about prevention. How do you do it? How do you prevent arthritis?
Well, probably the main thing you do is you stay active. Keep your joints moving. Activity stimulates bones to grow, as we talked about before, but it also helps to lubricate joints, keeps the muscles strong, which your muscles really, if you think about it, protect your joints, protect them from injury. So staying active is the main thing you can do. Maintaining as normal a body weight as you can. That takes stress off of the joints. And then just having common sense, being careful what you do with your joints. Don't, abuse them.
And if someone thinks they are having some joint issues, how is arthritis diagnosed? Are there tests?
Yeah, a lot of it comes from the history and from the physical exam, especially determining which type of arthritis is involved in the joint. When you talk about rheumatoid arthritis, it can take a while to make that diagnosis. It isn't always obvious in the beginning. There are some blood tests that are helpful. You can detect some of these antibodies that your immune system has formed. But even that is subject to interpretation, and so it can take some time. Osteoarthritis is a little bit more straightforward, and oftentimes X-ray can help there. There are certain things you can see in X-rays that will help you determine that it's osteoarthritis.
Once someone is diagnosed, are there medications that might be prescribed for treatment?
Yes, and again, it depends on the type. The non-steroidal anti-inflammatories, medicines like ibuprofen or Motrin, naproxen or naproxen, those anti-inflammatories are used for all types of arthritis. And then after that, it depends. If you have rheumatoid, there are some very specific treatments for that. There are medicines that alter our body's immune function, like methotrexate is a common one. Hydroxychloroquine actually is used as an immune system modifier that helps with rheumatoid arthritis. And then there are a lot of newer medications that have been developed specifically for the autoimmune diseases, including rheumatoid. When it comes to osteoarthritis, the choice of drugs is not quite as broad. Anti-inflammatories are helpful, but then after that, there are things where people are trying to simulate the body's cartilage, and that can be injected into joints. That seems to be somewhat helpful. But a lot of osteoarthritis has more to do with joint replacement and exercise, physical therapy, those kinds of things.
So let's talk about some of those other treatment options. What kind of physical therapy might somebody do? And can you talk about some of the surgical options as well?
Yeah, physical therapy, it's generally trying to strengthen the muscles around the joint, improve the range of motion of the joint, improve a person's balance, improve their fitness, and help them with good body mechanics to help them get through their activities of daily living without putting undue stress on their joints. So all of that's very important. When it comes to surgery, we talked about this a little bit in the last segment, but joint replacement has really come a long way in the last decade or so. And pretty much every joint in the human body can be replaced at this time. So
let's move outside of the clinical setting. You already touched on this a little bit, but there are lifestyle changes that people can make to kind of help manage arthritis and the pain. Let's start with weight loss. How does weight loss help improve arthritis?
Well, it helps in a couple of ways. First of all, it puts less stress on the joint if you just take some of that weight burden off. So that's a big way in which it helps. But then also, once your weight comes down, it makes it easier for you to exercise, easier to move, and so that's also good for your joints and good for your bones, good for your muscles. So it helps in a couple of ways.
So diet would obviously help with weight loss, but isn't there also something called an anti-inflammatory diet to help with arthritis?
Yeah, and when people talk about anti-inflammatory diet, they're talking about things that seem to promote inflammation. And processed meats, red meat, those seem to be pro-inflammatory. So you want to try and minimize those. And things like highly processed foods, sugar, white flour, rice, those are foods that tend to promote inflammation. So you want to diminish those. Tomatoes seem to be particularly bad. Now, on the other hand, there are foods that seem to fight inflammation, and those would be mostly the fruits and vegetables, olive oil, some of the beans, some of fish like tuna and salmon especially seem to help fight inflammation. So that's when people talk about an anti-inflammatory diet, that's what they're talking about. Avoiding the pro-inflammatory foods and eating more of the foods that fight inflammation.
We've also talked about the importance of exercise, but are there certain things people should do to protect their joints while they're exercising if they have arthritis?
Sure. One of the most important things is to make sure that you have good footwear. Whatever the exercises that you're doing, make sure that you have good supportive footwear that protects your feet, helps you with your balance so that you're not falling. And then if you have particular joints that are problematic, there are lots of ways that you can brace those. There are lots of assistive aids that help to support those. It's always a good idea to start slow in any exercise program, build up gradually, take rest days so that you don't overstress the joints and the muscles. Make sure that you drink a lot of water. If you get dehydrated, joints are partially protected by fluid in the joints. So if you get dry, your joints are dry. So make sure that you stay well hydrated and make sure that you use good body mechanics. And in all of these sorts of things, seeing a physical therapist can help you get started on the right path and give you pointers about all these things we've talked about.
Awesome. Thank you. That's our time. So we got to stop there. But thank you so much, Dr. Kunzweiler.
Thank you.
And thank you so much for tuning in today. We hope you'll come back and see us again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week, everyone.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.